Good evening, everybody. Thank you for being here tonight. I just want to remind you there are index cards on the front table where you can put questions in the basket. Then we'll have Dr. Mateus answer them. If you do have questions while he's talking, just raise your hand. Teresa here will bring you a card and put it in the basket, and then he can address all the questions when he's done speaking. So it is my pleasure to introduce and thank Dr. Bela Mateus from Solano County Public Health for being here tonight to talk to us about coronavirus and answer any questions or concerns.
Is it on?
You ready?
I'm ready.
Hand it over to you.
Good evening, everybody. Thank you very much for coming out. Let me start with some just basic background stuff that I think might be helpful to know about. The first is that as humans, we interact with our environment in ways that cause us to be exposed to various types of germs, viruses and bacteria and parasites all the time. And hardly a year goes by without dozens of new diseases affecting humans, from animals usually, but from a bunch of different sources. Most of the time, that exposure to a person isn't spreadable. It makes that person sick, but it doesn't become a human disease. So it's pretty uncommon, even with all the novel diseases we're exposed to have a novel disease that actually takes root and spreads. And this particular one is like that. This is a novel coronavirus. It's called COVID-19, which is a really boring name if you think about it. It just stands for coronavirus from 2019. All the other cool names have already been taken, and that's just the way it is. And so if we go back to the start of this century, you may remember we had SARS. And then after SARS, we had pandemic influenza, H1N1. And we had Zika virus. And we've had MERS. And we had a bunch of other things in between that didn't really impact the US, but were nonetheless important diseases like Ebola and other viral hemorrhagic fevers. So for a disease to be able to transfer into humans and take root, there have to be certain characteristics. It has to change so that it can go from person to person. If it can't go from person to person, it dies out. And it can't kill so many people that it burns out. And that's why Ebola is not that big of a risk becoming a worldwide pandemic, because it kills too many people. So this particular disease, the coronavirus 2019 or the COVID 2019, is a disease that in many, many ways is similar to most of the respiratory diseases we have. In our world, during the winter, there are dozens of different respiratory diseases that make us sick. And they're not all equally bad. The flu is particularly bad. It kills a lot of Americans every year, 20 to 40,000 in a good year. In a bad year, it can kill twice that. And so we are familiar with respiratory diseases in our community that can kill people. So what we have had to do with this new disease is figure out as quickly as we can who is most impacted and how do we stop its spread. Now, we already know that its spread is caused by respiratory particulates, things that come out of our respiratory system. So let me start by suggesting that by offering this virus appears to have started in China, where people were exposed to animals in the live animal market, and enough of the people were contaminated that it then was able to turn into a human-to-human spreadable disease. That pattern is sadly very common for these new types of diseases that we have to face. It's in a category called coronavirus. If you're not familiar with biology, that sounds really weird, and it is. You know, viruses and bacteria fall into categories, and there are lots of coronaviruses that make humans sick. There are lots and lots of coronaviruses that are human coronaviruses. This is now the newest one. Among the coronaviruses you may have heard about were MERS and SARS. Those are also coronaviruses. So this particular new strain hasn't been in our population. So what makes it scary, rightfully makes it scary, is it's new and there's a lot of unknown. We don't have immunity to it, so it spreads more easily. We know it can kill people. But if you think about it, we've got all kinds of diseases in the human population. How do we discover a new disease? The only way we're going to discover a new disease is if it kills a lot of people or hospitalizes a lot of people that shouldn't be killed or hospitalized. So until it's doing something dramatic, we would never even know it exists. But the mistake is to believe that the dramatic is the disease in its totality. The dramatic is just what's needed for us to notice it. And then we have to learn about how does this disease actually affect humans. And over the course of the last several months, we've had the opportunity to learn a lot of things about this coronavirus. So we know that it has symptoms that are very similar to influenza, which means that it's affecting our lungs. It causes us to cough, to have shortness of breath, to have fever. But that's only in the severe cases. Most cases of this disease are mildly symptomatic or non-symptomatic. So the very vast majority of people who carry this virus in their body will not even know they have it. They will have no symptoms, or if they do, it'll be like a cold. Unfortunately, some people will develop severe disease. They will require hospitalization, and if they're vulnerable, they may die. We've also learned from the time that we've been studying this virus that it has, unfortunately, a specific targeting of elderly individuals with underlying health issues. So this is not a disease that targets children of school age. This is not a disease that targets the otherwise healthy people. It is similar to influenza in that it causes its bad outcomes primarily in individuals who are older and who have underlying health conditions. Now, that's not good news, that's not bad news, that's just something we need to know. And that matters a lot to you as parents. As a community, it's important that it affects anybody at all. But we also need to know who in our community we need to focus on to be able to protect. So the way that it spreads, like influenza, is through what we call respiratory droplets. And respiratory droplets are blobs of liquid that you release when you cough or sneeze or when you touch your nose or your mouth. So those respiratory droplets get onto your hand or they're coughed out or sneezed out. So the way that you pass this disease from one person to another is if you cough or sneeze in their face so that it gets onto their portals, their mouth, their nose, or their eyes. Or if it gets onto your hand, you shake their hand and they bring their hand to their mouth. By far and away, the most common way it spreads is hand to mouth. Now that's extremely helpful to know because that gives you the opportunity to break the chain of transmission. If I'm shedding the virus and I'm bringing my hand to my mouth or my nose, I am now a vector to you. I may touch you, I may shake your hands. As long as you don't bring your hand to your mouth, nose, or eyes without washing it first or without using a hand sanitizer, it can't transmit to you. And that's true not just of COVID-19, that's true of all respiratory diseases that spread through droplets, which is most respiratory diseases. So if what I'm talking to you about is starting to sound familiar, like this is what we say to do every flu season, it's because this is how you protect against the coronavirus also. The things you do to protect yourself from person-to-person passing of influenza virus are the same things you do to protect yourself from person-to-person passing of coronavirus. So the precautions are the same precautions. If you're sick, stay at home. If you don't pass the virus to others, then you're reducing the impact on your community. If you're sick, try to isolate yourself at home from other family members. It's harder to do that in a family than among people that aren't your family. Obviously, we interact with one another in a family in ways where it's easy to pass these respiratory droplets pretty easily, but you need to think about what you're doing. And so if you're sick, but not so sick that you need hospitalization, you stay at home and try to stay away from other people until your symptoms go away. If you're sick and you need to be hospitalized, healthcare professionals are going to ask you a bunch of questions. If you're coughing, they'll probably ask you to wear a mask, and they themselves will be wearing a mask to protect themselves from the coughing and sneezing. Don't be offended. That is normal protection of the healthcare worker from the virus. So the precautions, other than staying home, is to avoid close contact with people that are sick. Now, the parent of a child cannot do that, but you can do that with one another, as adults, as adolescents, as people who are not in the same family. Avoid rubbing your eyes, scratching your nose, or touching your mouth, because that's how it gets into your body. It's been reported many, many times that if you watch people in an audience like this, their hand will go to one of those three surfaces about once a minute. So we're talking about a habit you've had for a long time. But if you focus on your hands and prevent them from doing that, you are protecting yourself from getting exposed to this virus, as well as every other respiratory virus that spreads from hand to hand. Wash your hands often with soap and water. And when we say wash your hands, we mean really wash your hands. You should be putting soap on all over your hand, in between your fingers, rubbing them to get the dirt off of it, and then putting it under the sink to remove the soap. If you're doing it in less than 20 seconds, you're not washing thoroughly enough. You know, we teach young children to sing happy birthday while they're washing their hands. That works for adults too. The point here is wash your hands appropriately. And if you don't have access to water, use a hand sanitizer. If you can train yourself to routinely wash your hands or use a hand sanitizer before you touch your face, after you've touched somebody else, you will go a very long way to protecting yourself from transmission. If you are coughing or sneezing, cover your cough or sneeze with your sleeve or with a tissue. Don't use your hands, because now you've contaminated them. Either way, if your hands do get contaminated, make sure you wash them before you interact with anybody else. Make sure that you clean and disinfect frequently touched objects and surfaces. I apologize. Make sure that you clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. I mean, there are some things in our homes that get touched a lot. Keep those clean. So essentially what I'm saying that you need to try to do is to keep your respiratory secretions to yourself and don't expose yourself to other people's respiratory secretions. Now, if this sounds boring, good, because that means you know what to do. There isn't rocket science here. This is not complicated in the sense of what you need to do. What makes this hard is that you really have to stay on top of it, because you really have to think about what you're doing when you're interacting with other people. The other issue that we sometimes get asked about is wearing a mask. If you have coughing or sneezing, if you're sick, wearing a mask protects other people from your droplets. So it's a good idea to wear like a surgical mask if you're going to be out in public. Healthcare professionals need to wear masks to protect them from the patients that are coughing and sneezing. Everybody else should not be wearing a mask. Not only does the mask not help you at all to prevent transmission, you are hurting healthcare by wasting resources that are in short supply. So masks in this situation are a very bad idea. And you might ask yourself, well, why? Well, I'm wearing a mask. What's the main way that I get the virus to me? It's not by somebody who's actually coughing and sneezing into my face. Jaylene, can you take my phone and throw it away, please? Sorry. I apologize, I should have turned it off. So where was I? Okay, masks. The primary way a disease passes is not by, thank you, is not by a person, I apologize. Okay, so the primary way that the disease passes is not by a person coughing or sneezing into your face, it's by hand-hand contact. You're wearing a mask. Let's assume you even know how to wear a mask properly so that you're covering your nose and your mouth properly. What do you do with your hand? You stick it under the mask to scratch an itch. You stick it under the mask to like, you know, do whatever you do with your mouth when you're touching your mouth. The mask does nothing to prevent transmission of a disease that is primarily passed on our hands. So don't wear masks, they don't help, and they do, in fact, make it harder for us to be able to supply emergency medical services and hospitals and clinics with the masks that they need. Okay, so what's been going on here in Solano with regard to this disease? We have had, in our county, evacuees at Travis for quite a while. So we got State Department evacuees, and then we got evacuees from the Diamond Princess cruise ship. Among them, they were all held in quarantine on the base. They were away from base employees. They were away from the community. They were never in touch with the community. Anyone who got sick was transported directly by ambulance into the isolation room of a hospital. In those first two plane loads of people, we had 5 individuals we had to transport who had symptoms, and none of them had coronavirus. On the Diamond Princess cruise ship evacuees, unfortunately, about 30 people had to be transported, and about 24 did have coronavirus. Those are individuals who, by and large, did not have any symptoms, but they'd been tested, they were positive, so we had to isolate them. Many of them remain in isolation because they have to stay in isolation until they clear their disease. But they have at no time interacted with the community, so they have not posed a risk to Solano County. The good news is because we had to deal so hard and long with that process, our hospitals were very in tune to coronavirus. We had the misfortune of being the first county that identified a community transmission of coronavirus. What does that mean? Up until community transmission, all of the cases of coronavirus were people who directly came back from China. They came back and they were sick and they were found to have coronavirus. And that was true of the cruise ship evacuees too. They'd visited China, they got infected, the boat got infected, they were bringing it back from China. Community transmission means that the person who got sick did not have a direct connection to China. They got exposed to someone else somewhere in their life in our community. That is an extremely important transition in a disease. When a novel disease is first identified, we try to contain it at the source. You'll remember that when this happened in Wuhan, we were prohibiting planes from coming back, and we were screening people at the airport, so we were trying to keep it from coming in. What we did not know at the time, what we couldn't know at the time, is that most of the people with the virus weren't sick. And if you weren't sick, you weren't quarantined. So we were letting through way more people with virus not showing symptoms than we were keeping out. So it's not surprising that it's in our communities. It's all over the country. It's pretty much all over the world. Even though the WHO doesn't want to use the word pandemic, this is a pandemic. And so the truth of it is that we no longer can use those techniques of containment to deal with coronavirus. We have to change how we think about it. Coronavirus is in our communities, and it's all over the place. The day after we reported that individual, there were, I think, 5 reports up and down the coast of up from Washington down to Southern California. The reason we were able to find it is because our hospitals had already been thinking coronavirus for so long, they knew better to look for it than someplace else. Unfortunately, the patient did not have any signs or symptoms of coronavirus. They had a mild version of it, no reason to suspect it, no travel link, so they were able to expose a lot of people in 2 hospitals before it was possible to even think about testing them. And that resulted in the hospitals having to put, between the 2 of them, hundreds of healthcare workers on furlough, quarantined and isolated at home, so that they wouldn't, we didn't know which of them was going to get sick. Well, we already know that in North Bay Vacaville, 3 of those healthcare workers that were exposed did become sick. And now we're investigating all their patients, and we're investigating their contacts to see if it's spread anywhere from them. This one individual from community exposure into the healthcare environment has resulted in over 400 people being under observation, and at least 4 other cases. So what does that tell you? That tells you this disease is spreading in our communities and has been for a long time. So why aren't people dropping in large numbers into the hospital like they are in Wuhan? Because most of the cases are mild and asymptomatic and aren't making people sick enough even to go to the hospital. And now that we know about this in our community, what we have done that's different is we're protecting our hospitals by making sure that the healthcare workforce assumes a patient has coronavirus if they have respiratory disease, which means that they will be on guard all the time. And that's really important to the hospital because they need to be open to take care of us. So we are protecting the healthcare environments by asking them to operate with a higher level of personal protection than would normally be needed for them. In the community, It doesn't make sense anymore to find a case of coronavirus, isolate them, find out everyone they're in contact with, quarantine them, and wait to see what happens for 14 days. Because pretty soon, you're talking about so many people, it's impossible to keep track of that many people. So that's no longer our strategy. Our strategy now is to have a conversation like this with you to let you know you can protect yourself from coronavirus by properly protecting yourself from respiratory droplets. You have a tremendous amount of capability of protecting yourselves and your families. And that's what we need to do in our community. We need the community to focus on what you would do with flu while we protect the hospital environment, and we are then going to need to start focusing our energy on protecting those people in our community who are most vulnerable. And that would be our elderly, especially our elderly that are in long-term care facilities or that are in residential settings where they're already more frail or they wouldn't be there in the first place. And so that's what we have to put energy into protection so that they don't have this, so we don't have the same experience that's been happening up in Washington. So why am I telling you all this? In part, I want you to know this disease is not as frightening as it would appear to be. It is causing illnesses that are not that different from influenza. But I don't want you to get complacent. Influenza is a bad disease. And we want you to be anxious enough that you protect yourself from droplet transmission. That is important. Turn your anxiety into proper habits that protect you. That is a very positive thing that we can all do. So that's the state of the disease in our community. So then, what about schools? Well, good news about schools is that the school-age population is not what this disease is targeting. With all of the tens of thousands of patients that have been identified, you can count on one hand the number that are under the age of, I think, 4. There's only been a few hundred reported cases in people under the age of 18. This disease is not affecting young people. So why is that important? If you take that together with the knowledge that this disease passes through droplets, kids in the school environment are passing the disease to each other in their social groups. They're not passing it outside their social groups. So if kids are passing it in their social groups, they're not only interacting in those groups in school, they're interacting in those groups in their lives. The school is not an environment that is encouraging spread. The school is not an environment that we have to worry about having coronavirus outbreaks in, because its passage and the age groups that are affected are wrong for school outbreaks. Now, I'm not going to say that I'm not worried about daycares. I mean, those of you who have daycare-age children know that they swim in saliva. You go into a daycare, and every kid is glistening with saliva. So clearly there's more droplet transmission in that environment than there is beyond about kindergarten or first grade. And so our considerations around school closure, from my perspective as health officer, are going to depend on the age group that we're dealing with and what we're seeing. But by and large, it doesn't make sense to close a school, high school, junior high, for a disease that's not spread in that environment uniquely. In fact, if we do close, what's going to happen? Those same kids are going to interact in the same way outside of school, do just as much disease passage, and on top of that, all you have to stay home from work. So that's a net bad outcome. It doesn't make sense to do it. But what we are thinking about doing, because we have to be thoughtful about who's at risk, is maybe canceling events among seniors that bring them closer together than they would otherwise be. So senior dances, senior gatherings where they're sharing food, bingo parlors. These are settings where the disease probably will spread more and put people in harm's way who are at risk of a bad disease. So what we are trying to do about the community protection is to be thoughtful. Now, having said that, like with influenza, if there are enough individuals in the school that are out sick, or not enough students showing up, then you close for logistical reasons. So I'm not saying that you don't close a school because of a disease, but we're not going to be closing it because it's a place where the disease spreads. We will be closing it because you can't function as an educational institution under certain circumstances. So the only other thing that I really wanted to focus on is the concept of stigma. Because this disease was initially associated with China, we saw a lot of situations where people were being racially profiling of individuals. And you gotta get past that. This disease makes everyone equally sick. It happened to start there, but right now across the world, the disease is spreading in all cultures, all races, all ethnicities equally well. And you want to remember that the person with the disease is a victim of exposure. They're not the perpetrator. So demonizing individuals who are sick is a really bad thing to do. The other thing that I want you to think about is that the transmission of this disease really only seems to be occurring when someone has symptoms. So if, for example, we have someone at home in quarantine, if I use the word quarantine, it means they don't have symptoms. If they're isolated, they have symptoms. But if they're at home in quarantine, then they don't have symptoms. So their kids can come to school, because if they don't have symptoms, then they probably don't have disease, certainly not right now. They're not passing it to their kids, so let the kids go to school. What's the point of not letting them go to school? You have to think it through that way. Every scenario is a little bit different, but in general, people without symptoms are not passing it to others. They're under quarantine because they were exposed, and we want to be able to catch them with symptoms as quickly as possible. But they are not themselves yet spreading. All right, questions? Okay, flu viruses survive on surfaces for 2 to 4 hours. Coronavirus lives 4 to 5 days on surfaces. Is this accurate? No, it's not accurate. Different viruses have very different survival characteristics, and coronaviruses run the full spectrum from being on a surface for seconds to being on a surface for hours. This particular coronavirus appears to be pretty fragile, and it's unlikely that it stays on surfaces for more than a few minutes. We don't know that for certain. It's too early to tell, but surfaces are not your primary means of spread. Your primary means of spread are each other. But if you're not sure, if you're not certain, and you're touching surfaces, what do? Wash your hands or use antiseptic before you bring it to your mouth. So treat the surface the way you treat another person's hands, and you're equally well protected. Would products like Lysol help keep surfaces disinfected, as is suggested with the flu, and how can schools keep classrooms sanitized in between classes changing? So yes, Lysol products and many other household cleaners are perfectly adequate to clean coronaviruses. Coronaviruses are not inherently tough. They're actually pretty weak as viruses go, so they're easily killed. As for cleaning surfaces between classes, I don't have a problem with that. There's nothing wrong with a clean desk. I remember growing up and wishing we cleaned desks between classes. So to get rid of grime and stuff, go for it. But don't do it because you think it's preventing the spread of disease. Do it because hygiene is good. CDC recalled test kits last week saying they were unreliable, so how can we or they then state that someone has a strain without definitive testing? So what happened was CDC, and actually a lot of other countries at the same time, developed the test. The CDC test was proven to be good, and then they started manufacturing it in large quantities to give to the states and local health departments, and when it got out, it was found that the manufacturing hadn't worked properly and those batches were bad. So the tests were just withdrawn. They weren't used to make decisions. The decisions now are still being made by test kits that are valid. The problem is we don't have enough of them. Since we're relying on CDC, and since CDC's manufacturing is still very slow, we're waiting for commercial manufacturing to be able to increase the numbers of kits available. So the tests that are being run are valid. The problem is there's not enough of them that we can run. When will we start seeing expanded testing for those with flu-like symptoms now that it has been acquired in the community? It's an interesting question, and the question I would ask is, why do you want to know? Why do you want to test yourself if you have no symptoms or if you have a mild disease? Sure. Your wife was exposed, so you have a different situation. That's not random community testing. You are a contact of a case. Well, she's isolated, she's being tested, we'll get a result. If she's positive, then you get to be quarantined. You can't, okay, so think about what you're asking. If somebody is asked to go home under isolation because they have symptoms, because they were exposed to someone, they need to not spread their respiratory secretions to you. You do the best you can. We test that person because we want to know if their sickness, their symptoms, are from the disease, from coronavirus. But you are not sick. So there is no value in testing you at all. If she is positive, we're still not going to test you until you have symptoms.
So we went to the ER and we were told that because she had no exposure to anybody that was on a cruise ship or from China, that they wouldn't test her.
They would not test her.
So she tested negative for influenza. She had flu-like symptoms. She's a primary care physician in the community. She's been not working for a week, and she's been isolated. I've been taking care of her, and I just like to know if she has it, and if we could just know.
So I understand what you're asking, and what I'm telling you is, if I only have the ability to test 20 people, I'm not going to test people who just want to know. I'm going to test people whose life depends on my knowing the answer. Hospitalized individuals who would benefit from the knowledge because it changes how they're treated come first. Now, if we have the testing available in the commercial market and you can go to CVS or Safeway or whatever and get the test, hey, that's on you, I got no problem with it. But while it's under the control of public health, I have to prioritize who I test. And I will tell you, there are probably several thousand people in this county who hate me because I said no. But I can't say yes to a person who's healthy at the expense of a person for whom the decision might save their life.
She's not healthy. She's been running a fever for a week.
You are the one asking for testing. You're here. You're healthy.
I'm not asking for myself. I'm asking for her. Also,
well, she'll be tested if she's hospitalized and gets sick enough. She's still at home.
But she also needs to get back to work. She's a primary care physician. We need people like that in the field to help.
So just so you know,
we couldn't get tested.
Just so you know, in the time that we've been standing here, I've had half a dozen phone calls from doctors wanting me to test people who are hospitalized. And if you're at home, you're not sick enough to be hospitalized, you're not in the ICU, and I only have so many tests to run, I'm not going to prioritize a person at home, irrespective of their job. Politicians are begging me to test them. You know, that has nothing to do with the job. It has to do with the fact that we have very few tests available, and if we don't use them on the right people, we're wasting those tests. So yes, she's sick, she's got a fever, but she's at home. If she's sick enough to need hospitalization, all of a sudden she's different. Now she's in the category of people for whom a test might actually change how she's treated. Now, this is only true today. If we get test kits in the county, we can loosen up testing easily. If it becomes available in the commercial market, a lot of people can get tested just by wanting to know. But right now, I have to ask the question, what will be done differently if the result is known? Having a person who is at home that we're assuming is sick and that's why they're isolated, what will I do differently? Nothing. They'll stay at home isolated. So if I'm not changing what's done for a person with a test result, then why would I do the test? That math gets thrown out the window when all you have to do is buy the test at CVS. You can do whatever you want. But until we're at that point, that I need to know that the person tested is going to benefit from the result. So I appreciate the emotional reality that you're dealing with. I'm not trying to minimize that either. Really what I'm trying to do is tell you that for every one of you, there are hundreds of you, and there are dozens of people in the hospital, in ICU, that I can't test because we don't have enough test kits. And this does go back to the question of why are we where we are? And I don't have an answer. I do know that when politicians are up there telling us that we have only 100 cases in the state or only 100 cases in the US, that's a bald-faced lie. We have no clue how many cases we have. We can't know how many cases we have because we're not testing. So those statements mean nothing. But what you're observing us doing in this county is being as realistic as we can be in the world we are in. We are no longer at a place without community transmission. We have to recognize that's going on. So I have to talk to you about the reality that there's community-based transmission and advise you on what you can do to protect yourself. Because we don't know who's a case. But we don't for flu, we don't for other respiratory diseases either. So that's why you have to be universal in your approach. You have to do it with everyone you encounter. So how can Vaca High School slow transmission or reduce risk? Again, I don't believe that this disease is spreading in the Vacaville High School environment. I believe it's spreading in the community, and if it introduces into the school environment on a person, it wasn't acquired here any more likely than it was acquired outside of here. So reinforcing to our students and to our staff and to our faculty how to do proper respiratory prevention, just what we're talking about here, is the best thing that VACA can do right now. It's helping everyone to realize what power you have to protect yourself. How long after you've had the coronavirus will you still test positive? That's a question that is very difficult to answer because it's a new enough virus that we don't really know. What we do know is some people have continued to test positive for a month or more after they resolve their symptoms. What we don't know is that if you have the virus in your respiratory secretions and you're not symptomatic, can you pass it to anyone? We don't know. Because the way the test works is it measures the presence of the organism. It doesn't measure the infectivity of the organism. So there are lots of diseases. This is really common with foodborne illnesses that come out in your diarrhea. You can have the presence of the dead material measurable, but it's dead, it's not transmitting. We don't have a way to test dead or alive for this virus yet. And until we do, we don't know what it means to be shedding the virus, for days or for weeks after. And right now, I can't really advise on it. What I can tell you is that it's really, really clear that symptomatic people spread much more effectively than asymptomatic people. And so controlling your symptoms and avoiding people with symptoms is your best protection at present. And again, we may learn more and change our advice with time. This disease and our knowledge about it has been moving so quickly. Hardly a day has gone by that we haven't had to change some guidelines somewhere. How long will this virus linger around? Does it have to get to pandemic level before it dies off? That's an excellent question, and the answer is it's kind of up to nature. If we just look at coronaviruses that we are aware of, SARS exploded with a bang, lasted for a number of months, and then disappeared entirely. MERS has a root in the Mideast and causes ongoing disease there, and occasionally jumps out and causes pandemics, and then the pandemic part disappears, but it still exists in the Mideast. H1N1, which was a pandemic flu that occurred in 2009 and killed a lot of people, has remained the primary strain of flu for 10 years, but it's gotten weaker and weaker. So if this disease takes the path of H1N1 and stays with us, the one thing we know for certain is that its ability to cause harm will diminish. And there's two reasons for that. Again, if it kills too many people, it can't stay around. So it has to kill fewer people just to be able to stay around. And the other is more and more people get immunity to it. The reason H1N1, the same H1N1 that 10 years ago was killing a lot of people, is killing so many fewer people, is because all of us have been exposed and have immunity, and it just can't infect us as easily. So if this disease does stay around, the benefit of that will be that it'll become one of the many diseases we deal with every year. It'll become part of our background, and we will have more and more community immunity to it, which will protect us even further. Will the vaccine be placebo safety tested? Yes, vaccines in this country can't be marketed if they don't go through safety and efficacy testing. It's one of the reasons why it takes 18 months to bring a vaccine to market. I don't know if you guys heard stories, I think it came out of somebody in Israel that they could manufacture a vaccine in a month. Well, you could probably manufacture something in a month that might protect some people, but it'll probably kill twice as many as it protects, so I'm not really into getting that vaccine. So for us to trust the vaccine, we need to let it go through safety trials, which means we cannot be sitting here today expecting a vaccine to help us this season, because there won't be a vaccine to help us this season. We have to do the other control measures that we keep talking about, the community mitigation measures of preventing yourself from being exposed to droplets. Do you think it's safe to continue volunteer serving at a lunch counter at a homeless shelter in Sacramento? I would say yes. If you're doing lunch counter work, you're not under obligation to get close enough to someone you're serving to have droplet transmission occur. If you can maintain a distance of 3, 4, 5 feet, you are protected from the droplet transmission. And then if you're wearing gloves, that should remind you not to bring your hands to your mouth until after you've had a chance to clean your hands. So it's actually a very safe way to interact because you've got a physical reminder, the glove on your hand, to protect you from bringing the droplets to your mouth if you happen to shake hands or anything like that. CDC is recommending no travel to affected countries. Will the virus still be active by this summer? You have a trip to Italy later in July. I feel you. I have a trip in 2 weeks to a part of the world that hasn't yet been infected, but will be, I'm sure, by the time I get there. And our travel plans get interrupted by pandemics, and unfortunately, there's just nothing we can do about it. You know, even if you choose to go, you may not be able to go. If planes aren't flying, if all the tourist attractions are closed because they're doing, you know, social distancing, then it's not even in your control to be able to go. I don't know the answer to how long. It depends on what will happen with the virus. If it takes the path of SARS, then 6 months from now, we will be having worldwide outbreaks that will still be a problem, and there will continue to be interruptions in all of these things. If it takes more of a path of MERS, it can be gone in a couple of months. If it takes the path of H1N1, it'll have diminished in severity enough by the summer that things will start to calm. And it's impossible to predict. There's no way of knowing for a brand new virus which of those pathways it's going to take. And so I apologize. All I can say is that I have, sadly from first-hand experience, know that the travel agencies, cruise ships, companies that do tours, et cetera, are being very, very generous at this point in time in allowing people to postpone their trips. To, you know, if you've got travel insurance, then clearly this is a valid reason for them to pay out. If you did it all on your own, that's harder because you don't have the benefit of something like that. So I apologize that I don't know the answer to how long it's going to stay around. And then can I speak on the FDA finding CDC labs contaminated? I actually don't know what that refers to. I haven't heard that. So I don't really know how to respond to it, and I apologize. I don't know what the question is referring to. So do we want to take open questions? Oh, no, you got more hand questions.
Hi. I just had a question. You mentioned earlier that the schools are making efforts to improve hand hygiene and respiratory hygiene. So my question is, how is that being tackled by the schools? I have a 10-year-old school, and as of last night, he told me that there really is no incentives or incentivizing from the teachers or any of the school staff to hand sanitize, to wash their hands, or anything along those lines. So I'm not sure if the school has any plan as to educate staff and students at this point.
So the question wasn't what are schools doing, it was what can schools do? The question wasn't what are schools doing, it's what can schools do, and I said they can do that. I'm not suggesting schools are doing that. Vacaville school officials are here, hearing this, and so that may staring at you, so the entire system could change. So this is something that schools can do. I'm not suggesting they are doing it, but this is something that, the question that was asked is what can we do to help deal with this in the school environment? That is something we can do in the school environment.
So the question was about hand sanitizer? I didn't hear all of it. Yes. And I also had a question here regarding hand sanitizer. Some of our classrooms have hand sanitizer, not all. We are in the process of putting hand sanitizers in all of our classrooms. There is a shortage of hand sanitizer. I've heard it today, actually, we have a shipment coming in and we found a contact for getting more. It will take some time, but we're putting them in all classrooms. The question I had about hand sanitizer also stated that you don't have them in the classrooms, but you have it here. And I went around the district office looking for hand sanitizer before I came here. I took some of those off of people's desks. One of them is actually from my desk. So there really is a shortage going on here, but it is something we're working on.
So let me respond. The question is if a faculty member is positive, then their coworkers would be quarantined, and is there a backup plan for providing education? The concept of quarantining the context of a case disappears rapidly when you have community transmission. It stops making sense. And we're not going to do that. The guidance for hospitals was that if a healthcare worker is positive, their coworkers have to all be quarantined at home. North Bay Vacaville furloughed almost 100 healthcare workers. That is a huge impact. That's way worse for the community not to have those healthcare workers than to monitor them for symptoms. So we persuaded the CDC and the state to change that expectation so that in the future, if a healthcare worker is positive, their coworkers don't have to leave unless they're sick. If they're sick, we test them and we isolate them. If they're not sick, they can keep working, but they have to do several things. They have to wear a mask when dealing with patients. They have to have their temperature and symptoms checked before they start work and in the middle of their shift every day. But at least you still have a workforce, and you're going to catch the symptoms right away, and you remove only those that are symptomatic. That same principle could occur in a school environment as well. Because, you know, think about it. If we have 20 or 30 cases in our county in random places, you're shutting down all kinds of businesses that don't need to be shut down because it doesn't work anymore past the first couple of cases. So the answer is that we wouldn't recommend quarantine in that situation. We would recommend that the school nurse monitor those staff on a regular basis so that the first symptom can be caught early and then you remove them from the environment.
And there were a couple questions about closing schools. We do take our direction from Solano County Public Health, who are the first to know when there's any risk. And what we've been told time and again is there is no risk, and I think Dr. Mateus mentioned that more than once. There's currently no risk to any of our students. There was a question about, is the reason you're not stopping classes is because of money? It feels that way. We actually, the state of California, if there's an emergency and we have to close schools, they actually grant us a waiver, so it doesn't affect our funding. So it absolutely is not about that. We have been told time and again there is no risk to students, and if there was, we would certainly close our schools. You already spoke to that, right, around closing schools. What are you going to do to stop parents from sending sick kids to school? We're doing what we always do. When a student is sick, we call the parent, ask them to pick the student up. This hasn't been an issue. Actually, kind of the opposite has been the issue. We have a lot of parents that are concerned in keeping their student at home, and we aren't penalizing them in any way for that. And at what point of infection would Vacaville consider closing schools? Same question. When public health tells us that there is a risk. And last one, my child has a New York trip with his class. Will he receive a refund if they're not able to go? Yes, if there's a trip planned with your class, they're not able to go, we will work with airlines or whoever else to work to get a refund. As Dr. Mateus said, a lot of cruise ships and airlines are actually granting that due to the coronavirus.
Are there enough tests in the county? No, we do not have test kits in the county. Our county laboratory has been begging for tests, you know, from the first day they were available. You should know we've been doing our best to get testing available in our county. So far, we've been unsuccessful. Promises keep being made, but the promises are like, yeah, the check's in the mail. And so at this point, until I get the test kit, you know, the only place we can get testing done is the state. And as soon as we have testing available, we will get the word out because we will change the rules for testing. If we have enough testing capability, we will test a lot more people than we're currently able to test. But we need the test kit delivered. We need multiple test kits delivered so that we can do that for our community. And you know, it's kind of, I mean, it's almost sadly tragic that some of the communities in this country that have test kits but no disease are testing anybody who wants to be tested. And Solano County, arguably the epicenter of community transmission, can't get a test kit. So I'm not going to even try to explain the why behind it. I have no clue. All I can say is that we are very fortunate that the state and the CDC have been working really, really well with us in terms of helping us get as much testing as we can get. But it's definitely not something that makes us happy that we can't do the testing. How many days between being exposed and showing symptoms? The range is from 2 days to 14 days. That's why we do 14-day quarantines. But most people who get sick will be sick by day 7 or 8. So like most of these diseases, even though the range is pretty long, the most common window of getting sick is 2 to 7 days. That's still a pretty broad window. That means that you really aren't going to be able to feel like you're out of the woods for a while. So if we have a family member who has an immune-compromised system, their immune system is compromised, do we send our children to school with fingers crossed that they don't bring it home? So two answers. One, that concern is not unique to coronavirus. That concern is valid to every disease in that community that you live in. Immune-compromising conditions compromise you against many diseases. So you have to be very thoughtful about how you expose the immune-compromised individual to the community. That said, second answer, for this disease, it's fine to send the kids to school, but monitor their symptoms. If they become sick, isolate them from the immune-compromised person right away to protect the immune-compromised person. So so kids might be mildly symptomatic, might not show it, but if that immune-compromised person is interacting in the community, they have just the same risk in the family as outside the family of being exposed. So unless you're living an existence where you're genuinely isolated from the community at large, it doesn't change. And the problem here is those same kids still not showing symptoms can be bringing home flu and other diseases too, which are equally harmful to an immune-compromised person. So this is a really tricky situation. The only good news about immune compromise is not all immune compromising conditions apply to all diseases. It is important to know from your healthcare provider what categories of diseases the person is immune compromised to. And so, the problem with answering the question by saying, yes, keep the kids home and don't send them to school, is that unless you're prepared to do homeschooling, I can't tell you how long this risk will last. And this could be a very prolonged period of not sending them to school. So you need to think about an alternative educational reality for those children. So you're the parent. You make the call. I am not going to tell you what to do with your kids or your family members. If you're asking me for what I advise, I would caution you to over-focus on corona at the expense of other diseases. If you are prepared to protect your family by not having kids go to school because you can homeschool them, then that decision makes more sense than if you're not. That's pretty much all I can say on that. But each situation is so individual that it's hard to have a generic answer. Does this virus have the ability to transfer to household pets? Sadly, it appears that it does. There has been one case reported of a dog that had coronavirus, but we don't know if it transmits in animals, and we don't know if it harms animals. I honestly, I don't know what to say. Many of us have pets, and we want to protect them. Some of us more than we want to protect our kids. And that's a valid concern. And if you are known to be sick and you're in isolation, be isolated from the pet as well. So that's pretty much, common sense. Don't interact with any living thing if you're in isolation. But apart from that, if you're mildly sick, you don't know that you have it, and you transmit to your pet, it's really very similar to what happens with so many other diseases. I mean, pets get flu, pets get other diseases also, and we transmit to them and they transmit to us. When I said that animals are the source of most novel diseases, that includes our pets. And so that interaction is a very... This is one of those situations where there's no good answer. Because the answer of don't have pets is a horrible answer. Pets give us so much emotional value that not having pets is actually bad. So you have to weigh these risks. And at this point, the veterinary community has not said coronavirus is bad for pets, separate from them, et cetera. But I would be lying to say that it can't transfer. What do we do when we have children who attend high school and have autoimmune issues? This kind of goes back to the family member with autoimmune issues as well. This is another reminder of the reality that all people with autoimmune illnesses have in living in our community. And I don't have a good answer. I do know that many people who have children in that situation do choose to have an EAP or to have homeschooling or some other way of educating them that doesn't put them into the school environment. But apart from what you would do for any other disease, if your child fits that category, I don't know what to advise for this disease because it's not different. The transmission methods are the same. The death rates are comparable to diseases that do circulate in our community. So it's a reminder of that consideration, but it's not uniquely different. What about healthy people being carriers and infecting those who have lower suppressed immunities? We cannot guarantee that that's not happening. We cannot guarantee that's not happening. But there's also nothing we can do about it. If you go back to universally protecting yourself from everybody else's respiratory droplets and them from yours, that is the best thing you can do, whether you have an immune-compromised system or not. It goes back to break the chain of transmission. If you break the chain of transmission, you are protecting yourself. And you're protecting yourself equally well if you have an iron constitution and never get sick, or if you get sick easily. So there's no magical way to go beyond that today. That is your best defense. Now, if a vaccine becomes available, clearly people with autoimmune issues and immune-compromised conditions should be at the front of the line to get a vaccine. That makes sense for any disease that they are at risk of, for which we have a vaccine, but that's a ways away. And so in the meantime, you have to break the chain of transmission from one person to another in order to protect yourself. Does the virus live in water such as swimming pools? Is it temperature sensitive? I apologize, I actually have no idea about its temperature sensitivity, but it probably doesn't live in pools. Pools are chlorinated. Chlorine would kill it, on contact, so that would not be an issue. An unchlorinated water body, I don't know if it spreads, like lakes and streams and things like that. I don't think anybody has even looked at that yet, because it's so obviously passing from person to person that we have to deal with that reality first. In terms of the environmental, but we do know that it's environmentally pretty fragile, so it's unlikely to live in water for any length of time.
Okay, I have one more question about soap in the bathrooms. Is there soap in the bathrooms? And concerned about particularly Vacaville. Yes, we actually have brought in some additional maintenance staff, and we're checking all the schools, not just wiping down, but ensuring that all the bathrooms are fully stocked. And if they aren't, they will be. Another one? Is this for me? Will events where students gather together be canceled or rescheduled? Again, that is pretty much related to closing schools or not. If there is a risk, they will be. At this point in time, we've been told that there is no risk.
How can we be sure someone sent home for self-quarantine is really quarantined? How are these people being tracked and monitored? So when this disease was first identified and people came in from China and we quarantined them, we were very aggressive in monitoring them. We had multiple time daily contact with them, made sure that they were measuring their temperature and interacting with us. We would send, if they had symptoms, we would send people, public health nurses, to their home to do the testing. So we had a pretty good handle on it. But that only makes sense when you're talking about containment. Where that cat is out of the bag, that train has left the station. Use whatever metaphor you want. It's too late to do containment. So that level of rigor doesn't make sense anymore. If I'm doing that for a person I know about and I'm ignoring the hundreds that I don't, all I'm doing is treating that person unfairly. So we will not be doing a lot of quarantine going forward because it doesn't make sense anymore. What we will be doing is identifying individuals with high-risk jobs and asking them to protect the individuals they're interacting with. So healthcare personnel, daycare operators, these are individuals who deal with people that are more susceptible to bad disease outcomes than the rest of us. And for them, we will potentially continue to be more aggressive about quarantine and isolation because we have to protect the vulnerable that they work with. But that's not true for most people. Most people aren't dealing with people that are inherently vulnerable, and so for them, quarantining them is not going to help reduce the spread of this disease anymore. It's in our community, it's going from person to person, we have no idea who has it. So, what we do in medicine, when we know what to look for, we look for it. When we stop knowing what to look for, we treat everybody as having the risk, and that way we're universally protecting ourselves. That is where we need to be in our community. We have to have a universal approach to dealing with protecting ourselves. I want to know what the protocol is when our students test positive for the virus. Well, so if a child has reason to be tested and they're positive, they will be isolated while they are ill. So the advice to people with illness is going to be stay home till your symptoms go away. And that will be what it is that we need to do for children just as it is for adults. So we're not going to treat them differently because they have a disease and they have to get over the disease before they can return to their normal behaviors. Is the mortality rate 4 times higher than the flu? That is an excellent question. We don't actually know the mortality rate for this disease yet, and here's why. Remember I told you earlier that the only way you can notice a new disease is when a bunch of people are dying. So the first thing you see is dead people. And then you start to see the sick people, the ones that are hospitalized. So your picture of the disease is so narrow, you're not seeing the people with mild disease or asymptomatic disease, but they're part of the death rate calculation. If you're in Wuhan, or really anywhere in Hubei province right now, your life for the past several months has been utter chaos in the healthcare environment. Those kinds of pictures of hospitals overrun with bodies on stretchers and out into the street is what they've been living. They can't test everybody. They don't know if people are dying from this or not. They're burning bodies because they want to be safe. But not everybody who's dying has been tested. Not everybody who's sick has been tested. And nobody who's not sick has been tested. So there's just no way to know what the death rate is when all you're seeing is the worst of the worst. There was one opportunity, but it's aberrant, which was the Diamond Princess cruise. There were about 4,500 people on that vessel, and ultimately there were about, I think, 9 deaths. So if you assume everybody was exposed, which they were because that was a perfect petri dish, then the death rate is about 2 per 1,000. But that, again, was an aberrant community because it was predominantly elderly, and their exposures were more intense, and they didn't have access to health care as rapidly as they would have in the community. So that, too, is an exaggeration of the death rate. So what that means is it's lower than 2 per 1,000, and that gets to bring it pretty close to a bad flu season. So you're talking about, compared to a good flu season, it might be 5 to 10 times higher. Compared to a bad flu season, it might be 2 to 5 times higher. So it still appears to be higher than flu, but not by as much as we originally had reason to suspect. It's much lower than MERS. It's much lower than SARS. So we know that it's somewhere in the range between those. But when I say we know, we only know what we know. Nobody has had the opportunity to do a community surveillance study to see how many people are asymptomatic. We didn't even think there were asymptomatics until the evacuees. When we started finding one after the other, they were asymptomatic but had the disease. And we have no clue how many have mild symptoms. Our best guess is that 80 or 90% don't have severe symptoms. But those are guesses. So the answer to the question is, I honestly don't know. I am not prepared to say it's 4 times higher. It could be anywhere from 2 to 10 times higher, but we won't know until enough time has passed that we've had more opportunities to measure the death rate. Why is that not true? So the point you're making is that the World Health Organization is publishing a 1% death rate because of Wuhan, Italy, Hong Kong, and Iran, every one of which is tip of the iceberg ascertainment. So that is so completely biased that it means nothing. They published a 20% death rate for SARS. It ended up being below 1. So you know, take this stuff with a grain of salt. So I'm not being dishonest when I say that I think it's only a little bit higher than flu. I'm adding to it the reality of knowing about these types of diseases after many, many decades of experience with diseases like this. Okay. Flu has a mortality rate of less than 0.5%. Coronavirus has a current mortality rate of 3.4. China said they found a secondary strain, meaning the virus is mutated. Is this true? I don't know that it's not true about the second
That was not
strain.
my question. You're answering somebody else's question.
Sorry, I don't know that it's not true about the second strain because China, how can I say this without coming across as being derogatory? China's public health system is not competent to answer the kinds of questions you're asking. Not inherently not competent in Hubei province at present. They have been so overwhelmed for so long that they can't answer a question as specific as that. So has it mutated in additional strains? Maybe. Honestly, don't know that it hasn't. But reporting a 3.4% mortality rate means that they're using the numbers that they have, which I know to be filtered tip of the iceberg numbers. They as much as admit they have no clue how many people have mild disease. They as much as admit they've never tested for asymptomatic disease. We know those exist by the people we've observed here. So they cannot report a death rate that is accurate if they haven't even looked at the full pyramid of disease. It's just not possible.
That was not my
I'm
question.
answering this question.
Thank you. So my question is, for the parents that have kids that suffer from asthma, are they like in a higher risk of getting?
So children with asthma are at higher risk of acquiring most respiratory diseases, yes. I mean, because asthma is going to be, on some level, weakening your immune system, not necessarily because of the asthma, but possibly because of the treatment you're on. Mm-hmm. And so, yes, children with asthma do have a higher rate of acquiring all kinds of respiratory diseases. They would be at a higher rate of this as well. I've been a parent. I know it's impossible to do this, but I'm obligated to recommend it nonetheless. Teach your children to avoid exposure to other people's droplets because that they have to do to protect themselves if they have chronic pulmonary disease like asthma. They have to do that. That has to become part of their habit, or they will forever be exposing themselves to a greater risk than they should. But I also know I've told my kids a lot of things and none of it ever sticks.
Thank you for answering that, doctor. I also have one more thing. I have a 6th grader that he needs to get 2 shots at the hospital for him to move on to 7th grade. And he had told me he doesn't want to go to the hospital to get shots because he's going to get the coronavirus. I don't know what to do.
I apologize. I had a hard time hearing what you said.
So I have a 6th grader that needs to go to 7th grade, and he needs to get 2 shots to be able to enter 7th grade. It's a requirement for the district. And he doesn't want to go to the hospital because he's afraid to get the coronavirus. So I've been talking to him, and he doesn't want to go to the hospital. So he needs to get the shots to move on to 7th grade.
So the child can get their shots through a primary care provider. It doesn't have to be the hospital. It doesn't even have to be a hospital-associated clinic. In our county, we have 6 FQHC clinic systems that provide care. You have fabulous ones in this county. You have CMC and you have the county clinic, and they can go there to get the shot, and then they're not going into a hospital, and that might psychologically cause a reduction in fear.
Okay, thank you, doctor. I'll do that.
Thank you so much. Thank you, Dr. Mateos, and thank you, everybody, for being here tonight. That's going to conclude our town hall. Appreciate it. Thank you.